Types of disasters and their impact on healthcare systems is the title of this session, which focuses on the critical relationship between large-scale emergencies and the medical infrastructure designed to handle them. We will examine how different categories of disasters create unique pressures on hospitals and clinics. Understanding these categories is essential for healthcare administrators and clinical staff to develop robust response strategies. This presentation breaks down the specific challenges posed by natural events, human-induced crises, and public health threats, emphasizing the vital role of facility preparedness in maintaining community safety and operational integrity during the most demanding circumstances. Natural disasters are the first category we explore, defined as events like earthquakes, floods, hurricanes, and wildfires that arise from environmental forces. Potential hospital challenges during these events are significant, often involving physical damage to infrastructure, widespread power outages, and sudden patient surges that can overwhelm standard capacity. Emergency response needs dictate that hospitals must proactively prepare for these sudden increases in patient numbers, while simultaneously managing severe service disruptions. This requires a dual focus on maintaining the physical integrity of the building and ensuring that medical staff can continue providing care despite the loss of municipal utilities or restricted access to the facility. Man-made disasters represent the second category, encompassing events such as explosions, industrial accidents, and terrorist attacks resulting from human actions or errors. Safety and security risks are a primary concern here, as hospitals may face complex chemical, biological, or physical hazards that are not present in natural events. Response planning requirements for these scenarios are specialized. Staff must be rigorously trained to handle traumatic injuries and manage contamination through decontamination protocols. This ensures that the hospital remains a safe environment for both the existing patient population and the incoming victims of the specific man-made incident, preventing the facility itself from becoming a hazard zone. Public health emergencies are defined as outbreaks of infectious diseases or epidemics that rapidly affect entire communities and regions. The impact on patient care is profound, characterized by a massive increase in patient load and a heightened risk of disease transmission within the hospital walls. To manage these risks, special preparedness measures are mandatory, including the designation of isolation areas to separate contagious patients. Furthermore, hospitals must maintain a robust supply of personal protective equipment, or PPE, and strictly enforce infection control protocols to protect healthcare workers and prevent the facility from becoming a vector for the further spread of the disease. Impact on healthcare facilities focuses on the physical and operational consequences of disasters, starting with infrastructure damage, where buildings, utilities, and medical equipment may be compromised. Disruption of services follows as a direct result, where essential functions like surgery, intensive care unit operations, and diagnostic testing may be severely limited or halted entirely. Finally, staff and patient safety risks are a constant threat during a disaster, as both groups may be exposed to secondary hazards like falling debris, hazardous leaks, or extreme weather. Protecting the people within the building is just as critical as maintaining the technical capabilities of the medical equipment itself. Importance of preparedness is the final theme, highlighting that minimizing casualties is the primary goal of any emergency plan, as it directly reduces injuries and fatalities. Maintaining continuity of care is equally vital, ensuring that hospital operations continue effectively and that chronic patients are not neglected during the chaos. Lastly, efficient resource management is achieved through pre-planned procedures that help administrators allocate staff, physical space, and medical supplies effectively. By preparing in advance, healthcare systems can transition from normal operations to emergency mode with minimal confusion, ensuring that every available resource is used to save lives and support the community.